Have you ever wondered, is there a single oral technique that can dramatically increase pleasure? One so effective, a woman might quietly, intensely want more? Maybe you've tried things, felt uncertainty, worried you might do something wrong, or that with age, changes in sensitivity make pleasing her more difficult. In this video, I'm going to teach you one evidence-based, medically sensible technique, a gentle but powerful method that many women say heightens pleasure far more than typical methods. We'll also talk about how aging, hormone shifts, and physical changes can affect sensations and how to adapt. Stick with me to the end and you'll know exactly how to apply this technique, why it works, and what to watch out for, so you don't accidentally cause discomfort. Let's begin. First, what often goes wrong? Many people rely solely on a flat, back and forth tongue motion over the clitoris or labia. That can be okay, but over time, it may fail to stimulate deeper structures or may become numbing or irritating. As women age, several factors change. Reduced estrogen levels lead to thinner mucosal tissue and sometimes reduced natural lubrication. Blood flow to the genital area can diminish slightly, altering sensitivity. Past surgery, childbirth, or scars can affect nerve pathways. Hormonal fluctuations, for example, perimenopause, menopause, can alter nerve thresholds. So, a technique that works in youth might lose effectiveness later. It's not that pleasure disappears, it's that the method must evolve. Also, women often report that combining internal and external stimulation gives stronger responses because of how nerves connect inside and outside. That brings us to the number one technique I want to teach you. Section 2, the rim plus inside sweep technique. What it is and why it works. Here is the method. I'll call it rim plus inside sweep. It combines delicate stimulation at the edge, the rim of the vulva or vaginal entrance, and a sweeping motion internally synchronized with her arousal rhythm. Here's the step-by-step. 1. Warm-up and lubrication. Start with plenty of water-based lubricant or with natural lubrication. Warm your mouth and lips, kiss gently, tease the outer labia, build anticipation first. Don't rush. 2. Edge rim tracing. With your tongue, soft tip, trace gently around the rim of the vaginal opening, the inner edge of the vulva, just outside, in a circular or sweeping arc motion. Think of gently hugging the edge with your tongue. Use light pressure first, gradually increasing as she becomes more responsive. 3. Gentle internal sweep. Once she's receptive and you sense increased wetness, gently insert the very tip of your tongue, or a finger if she's comfortable, just inside the entrance, a couple of centimeters. Then sweep outward in a gentle wide U or C shape, coordinating the outward sweep with the same arc path you traced on the rim. The idea is your tongue's internal sweep stimulates the inner tissues and nerve endings connected to the deeper pathways, while your rim tracing keeps external pleasure, and the two combined often heighten the effect. 4. Synchronization and variation. Match your strokes to her breathing, moans, and muscle contractions. Sometimes do only rim tracing, sometimes only internal sweep. Sometimes both together, rim tracing plus internal sweep in tandem. Slow to medium speed works best. Vary pressure and pause when needed. Use pauses, resting strokes, to let sensitivity rebuild. 5. Feedback and adjust. Ask her softly which pressure or direction feels better. She knows her body. Always adapt to her cues. If something hurts or feels raw, back off. Why it works with medical and physiological grounding. The rim area is richly innervated with many nerve endings. The internal sweep targets deeper vaginal or vestibule tissues which share nerve pathways with the clitoris and internal structures. The combination can trigger summation of sensations, external plus internal, producing more intense arousal. This method avoids overstimulation of one spot, reducing numbness by alternating or combining paths. Many women describe that this gives a layered, deep, spreading pleasure, not just a surface tickle. Section 3. Tips, cautions, and adaptations for older couples. Before you try, here are important tips and cautions, especially for older viewers. Gentleness is key. Because tissues tend to be more delicate with age, avoid aggressive or hard scraping motions. Adequate lubrication is essential. If natural lubrication is less than before, as often happens in menopause, use a high-quality water-based or silicone water-compatible lubricant. Mind sensitivity changes. Some areas may feel more sensitive or tender. Avoid pressure there. Pace yourself. Don't rush toward orgasm. Many older couples find slower arousal gives better endurance and satisfaction. Use your finger or tool support. A gloved finger, lightly lubricated, can gently support the internal sweep or amplify motions. Breathing, pelvic awareness, muscle engagement. Encourage her to breathe deeply, soften pelvic floor. Her voluntary or involuntary contractions can guide you. Respect boundaries. If she says pause or slow down, stop. Always seek enthusiastic consent and ongoing feedback. Also, remember that sexual health is linked to overall health. Cardiovascular health, hormone balance, hydration, muscle tone, and stress levels all influence sexual response, so improving general health will help make this technique more effective. Section 4. To master this technique. Practice slowly and patiently. Don't expect perfection immediately. Start with rim-only tracing before adding internal sweep. Experiment with different curve radii, wide sweep versus tighter, and speeds. Occasionally shift to variations, small circular flicks, light tapping, pauses, microcircles, always returning to the rim plus sweep combo. Over time, you'll sense when to intensify the sweep, or when to stay light based on her responses. Record in your mind which motions elicited the strongest reactions. Those are your go-to moves. With repetition, muscle memory and intuitive sense develop, and the technique feels natural. So, there you have it, the rim plus inside sweep technique, explained clearly and grounded in basic anatomy and sensitivity changes. If you use it with patience, gentleness, communication, and adaptation, many women tell me it becomes their favorite method, something they look forward to and can't get enough of. If you found this video useful, please like it, subscribe to the channel, and share it with friends who could benefit. Leave a comment. Try it gently with your partner and tell me which variation she liked best. Thanks for watching. Take it slow, stay connected, and pleasure wisely.